It is on track to be the biggest economy in the world in the next 5 years. China's growth has been spectacular, but its healthcare system hasn't adapted to all the changes that have come with that growth until now. If we take a look at healthcare spending per person around the world, you can see it's actually very uneven. The U.S. has the most expensive healthcare, nearly $9,000 a person on average. In France, it's less than half that. In China, it's just over $300 a year. Contrast that with neighboring Myanmar, emerging from decades of isolation, just $15 per person. That's about the lowest anywhere in the world. Now, China's healthcare system is generating a lot of interest, actually, for its investment potential. CCTV's Owen Fairclough is with me now. Welcome to the show, Owen. There are some really big changes in healthcare underway. Tell us about that.
Well, Jessica, the problem with China is that the healthcare isn't really where the people are anymore. We know the story of China, unprecedented rural migration. We have half the population of China now living in urban areas. In around the next 5 years or so, that's going to rise to 60%. The problem is 3/4 of doctor surgeries in China are in rural areas, many of them small village outposts that aren't really appropriate for the kind of shift we're seeing, the demographic shift we're seeing in China. All of these people, of course, require healthcare. All these people moving to cities. You're going to have 250 million elderly people by 2030 in China, many of them in cities. That's double the amount now. But of course, with all this economic prosperity comes rising living standards, and the thinking is that people will have more money to spend on healthcare. Now, the government is starting to build more private hospitals as well as public institutions as well. But that has investors very interested. We're seeing some big money going into China, some big deals on healthcare, and foreign investors are looking at all of these demographics and thinking there's a profit to be made down the line.
And what about the Chinese government? How do they want to turn this around?
Well, they've got some big targets as well. In the next 5 years or so, they intend to double the number of doctors in China. They're going to add around 50% more nurses and increase the number of hospital beds by around a third. These are impressive targets, Jessica.
Wow.
Doubling the number of doctors, for example, would put a country like China, it would still lag behind many advanced economies, but in terms of hospital beds, China would have as many hospital beds as a country like the UK, for example. Well, all of this is going to cost around $1 trillion. That's one estimate of what it will cost. If China is investing in bricks and mortar for health, it's the system that actually needs changing right now. The government says around 90% of the population is covered by some kind of health insurance, and yet we hear more and more stories, some horror stories of people in desperate circumstances. Farmers, for example, who are forced to amputate limbs because they cannot afford health care. Corruption as well is a problem in China. There have been lots of stories, lots of reports of doctors and nurses taking bribes to overprescribe drugs, and that's been reflected. GlaxoSmithKline, one of the biggest healthcare companies in the world, was fined $500 million for providing bribes to doctors and nurses. It was fined last year. So lots of work still needs to be done in reforming the actual healthcare system.
But where there's a lot of risk, often there's a lot of reward. Thanks, Owen, for that report.